Thank you so much. People are more concerned now than ever about their health, helping their children stay healthy and also living a better quality of life. And those are things that are a priority for One Community Health as a healthcare provider. So right now we have joining us Community Health CEO, we have Christy Ward. And Christy, I would love to know more about One Community Health. I understand that there's a little bit of an evolution to really address a lot of the health concerns for the broader community.
Yeah, One Community Health is a community health center. We're a federally qualified health center. So what that means is we are a health center that specifically is here for a community that may not be able to afford health care. But our doors are open for everyone, regardless of their ability to pay.
Okay, and tell us a little bit about some of the services, though, that people may be able to access through One Community Health.
We have very comprehensive, what we say comprehensive medical home. And what that means is not only do you have your medical providers, but we also offer dental care, we have psychiatric care, we have nutritionists, we have a pharmacy in our facility. And so we really think about having all of the services as much as we can, have them in one center so that you don't have to go to other practices or be referred out. We want to have as much as we can within our own four walls.
That's great because, I mean, if anyone who's ever had to navigate healthcare, just period, we all know that that's part of the challenge is just the process of you think you have an issue getting it diagnosed, then you have to go see this specialist, and you have to wait for that referral to go there, and then trying to access all that, to have that all in one spot is incredibly valuable.
Absolutely. And, you know, one of the things that we have recently integrated is behavioral health and case management into our medical team. So when a physician is seeing a patient, and if there are things that maybe the patient has some concerns around, having food or housing, they actually have someone that they can just pull in as elbow support to be able to step in and help to identify how we may be able to help that patient in the moment without having to then refer them out for those services.
And then you also know, too, that they're getting that service now, and that it's not something that you may suggest and then they let fall by the wayside. So you can guarantee that, you know, they're taking the proper steps to have that better quality of life.
Right.
Yeah. And then tell us, though, too, because we all know health insurance right now is such a wild card for so many.
Right.
And healthcare costs, we just see them continuing to climb. So talk to families, talk to those who really need some health care, but they're really concerned about what it's going to cost them.
Right. As a community health center and a federally qualified health center specifically, we take insurance and we take, you know, Medicaid insurance. But we also, there are many people in the community that don't have insurance or don't know how to access those services. We have folks who can provide those screenings to determine what people may be eligible for. And if they don't have and don't qualify for medical insurance, for example, we do provide a sliding scale. So based on their income, we will be able to provide, you know, services that will meet what their income level is.
So it adjusts to their needs and their abilities. So how do those watching become One Community Health patients?
Well, we have a website, OneCommunityHealth.com is a way that folks can find out more about our locations and our services. Our phone number also is 916-443-3299, and they can call that phone number to find out more information as well.
And is there a website, too, that people can go to find out a little more information?
Yes, it is OneCommunityHealth.com, and it's just it's our name with the .com.
Okay, excellent. So OneCommunityHealth.com, make sure you check it out and start living a better quality of life today.
Yes, absolutely.
Thank you so much, Chrissy.
Thank you for your time.
Yeah, great to have you on. Already want to stick around because coming up, we're going to